Hello everyone, welcome. I'm Dr. Shariful Halib and today I'm going to talk about brainstem syndromes. So brainstem is simply the stem of your brain. So the part of your brain which contains all the cranial nerve nuclei and all the tracts that run from and to the brain or to the cerebral cortex. And that's why this is a very densely populated area. And that's why the brainstem syndromes have multiple symptoms of cranial nerve nuclei and also the descending and ascending tracts because there are so many of them. And to get an idea of brainstem syndrome, first of all, the main thing is it's not that tough actually if you have the basic orientation of the blood supply of the brain and also a basic orientation of the cranial nerve nuclei where they sit and also a basic idea of the tract or general organization. I think you're pretty much oriented up until now, but I'll try to make it easier for you. So here on the right side of the first aid page 462, you can see the blood supply of the brain, and I'm going to focus on the posterior circulation. So as you can see here, you have the vertebral arteries arising from your subclavian arteries on two sides, and those are going up along the cervical vertebrae, and then they fuse to form the basilar artery. So as you can see from here, this is one vertebral artery going up and this is another vertebral artery going up, and they fuse to form the basilar artery, and then the basilar artery ultimately divides to form the posterior cerebral artery, and also it gives a branch called the posterior communicating artery. And what we need to learn about are the branches of the basilar and the vertebral arteries. So one important branch is the superior cerebral artery, but it does not cause any brainstem syndrome. Maybe it causes, but it is not that much important for your step 1 exam. But what are important are those three vessels. You have this anterior inferior cerebral artery, posterior inferior cerebral artery, and the anterior spinal artery. So let me have a basic idea of what's going on. So first of all, as you can see, with cerebellar arteries, anterior inferior and posterior inferior, you are going to have some cerebellar syndrome. And the common cerebellar syndromes are you'll have cerebellar symptoms, or you'll have ataxia and you can have dysmetria. Next is to look at the surface of the brain from inferior view. So as you can see here, those two are the vertebral arteries forming a basilar artery going up, and those vertebral arteries on the lateral side, on the proximal region, it supplies the cerebellum through the posterior inferior cerebral artery. So this curving artery, both of them are the posterior inferior cerebral artery. So they not only supply the cerebellum, but also they supply the lateral part of the medulla, because as you can see here, up to this line, this is the medulla, and this is the pons. So it supplies the lateral part of the medulla. And I think this artery, which is anterior inferior cerebellar artery, this should be a bit higher because it supplies the cerebellum, but also it supplies the lateral part of the pons, or lateral surface of the pons. And above pons you have the midbrain. So this is the basic idea of the blood supply of midbrain. So if anytime you have a damage to the cerebral arteries, you are going to have ataxia, you are going to have some cerebellar symptoms, but also you are going to have some symptoms of cranial nerve nuclei, number one, and number two, some symptoms involving a spinal tract. So those two are extra. And also you have the anterior spinal artery, which runs along your medulla, in front of your medulla, and then it will run in front of your spinal cord. That's why it's called the anterior spinal artery. And as you can see, it supplies some part of the medial medulla. So it supplies the medial part of the medulla. Okay, so that's the basic idea here. And the next thing I'm going to look at are the cranial nerve nuclei. So that will be very important. So here I have an image for blood supply again. So this is the orientation of the blood supply of the brainstem on a lateral view. As you can see here, this is your vertebral artery going up, gives off a branch called PICA, or posterior inferior cerebellar artery, which supplies the cerebellum, but also it supplies the lateral part of the medulla. Then you have another artery called AICA, or antero-inferior cerebellar artery, supplying the cerebellum, but also it supplies the lateral part of the pons. Then you also have the superior cerebellar artery and the posterior cerebellar artery, which are, I think, are not that high yield. Then let's look at the cranial nerve nuclei. So if I want to have a basic orientation of our cranial nerve nuclei, I think the most easiest one to focus on the one which are very common, or the one which are classic. So for midbrain, the classic cranial nerve nuclei for me is 3. And for pons, the classic cranial nerve, so for midbrain, you have 3. For pons, the classic one for me is 7. And for medulla, the classic cranial nerve nuclei is 10. And also you can say 9, because they have a common origin called nucleus ambiguus, which lies inside the medulla and the lateral part of the medulla. So those 3 are going to make a big difference, those 3 numbers. So 3 and then 7 and then 10. As you can see, if you add up 3 and 7, you're going to have 10, right? So those 3 numbers are going to make a big difference. So whenever you have a damage of your medulla, you are going to have a cranial nerve 3 lesion. And actually we have a syndrome called Weber syndrome, where you have a damage of the cranial nerve 3 nucleus, causing the drooping of eyelid and also the lateral and inferior deviation of your eye, along with mydriasis on the same side. And for pons, as you have the 7th cranial nerve nuclei, if you damage or if you occlude the anterior inferior cerebral artery, you are going to have a lesion involving the facial nerve nuclei, causing facial drooping or a lower motor neuron ablation. And if you have a lesion involving the posterior inferior cerebellar artery, your posterior inferior cerebellar artery is going to damage the cranial nerve nuclei, especially of 10, but also of 9, because they have a common origin called nucleus ambiguus. So it will damage the nucleus ambiguus, causing hoarseness of voice and dysphagia. So those 3 are the most classic ones. So this is our very basic idea. You have to memorize it anyway, or you can actually see that in the upper part of the brain you are having the upper cranial nerve nuclei, then you have the middle part of the brain, middle part of the brainstem nuclei, which lies in between, which is the 7, and in the lower part of the brainstem, in the medulla, you are having this 10th cranial nerve nuclei, which is actually a lower cranial nerve, right? It makes sense. It actually makes sense, a lot of sense. Then, having this primary idea, then let's go a bit deeper. So whenever you have this cranial nerve nucleus, those cranial nerve nucleus actually lies on the lateral part of your brainstem. So there are very few cranial nerve nuclei that lies in the medial part of the brainstem. Most of the cranial nerve nuclei actually lies on the lateral part of the brainstem, and that's also a very important idea. So in the pons, you have this 7, and the medulla you have this 10. But there is something common in between the pons and medulla. So the common thing in pons and medulla, I should let me erase this. Okay. Delete it. Okay. So here let's start drawing again. So this is the midbrain, this is the pons, and this is the medulla. So there is something common in between pons and medulla, especially based on the cranial nerve nucleus. The sensory tract of the trigeminal nerve actually runs along the lateral part of the pons and medulla. So 5 is a common one. And then also the vestibular nucleus runs along in between the pons and medulla. Actually, I'm not anatomically correct, but I'm functionally correct. So this is also runs along the pons and medulla. So you have 5 and 8, which are common cranial nerves. So 5 and 8, they lie both in pons and medulla. And if you have a lesion involving the lateral pons or involving the medial lateral medulla, so a lesion involving the AICA, which is for pons, and a lesion for PICA, you are going to have those symptoms which are common to both of them. You are going to have symptoms like vertigo, vomiting due to lesion of the 8th cranial nerve, and you are going to have loss of sensation of your face on the same side. So this is very common in both of those syndromes, in AICA and also in PICA. Okay, so this is another set of idea. And the last set of idea that I'm going to talk about is the spinal tract. So the basic idea is you already know the spinal cord orientation, and as you can remember, in your spinal cord, the basic orientation is for your sensations like pain and temperature. You have the spinothalamic tract, which is also called the lateral spinothalamic tract, because this is part of the anterolateral system. And as you can see, they lie on the lateral part of the spinal cord. So it would make sense if they lie on the lateral part of the pons and medulla. And actually they make sense because this tract on both sides of your spinal cord goes up along the lateral part of the spinal cord and also goes up and up along the lateral part of the medulla and also along the lateral part of the pons. So whenever you have a lesion of AICA damaging lateral pons, you will also have damage of your spinothalamic tract. So let me draw that a bit. Okay. Delete. Okay. So let us consider that this is pencil. So let us consider that this is your spinothalamic tract, and this spinothalamic tract runs along the lateral part of your medulla and pons. And whenever you have damage of AICA and damage of PICA or posterior inferior cerebral artery, you are going to have a damage of the lateral spinothalamic tract. And as you can remember from your anatomy of the spinal cord, that the lateral spinothalamic tract actually decussates in the spinal cord itself, and it actually crosses the spinal cord through the anterior commissure and goes up on the opposite side. And that's why whenever you damage the lateral spinothalamic tract, this is going to have an effect on the pain and temperature sensation from the opposite side of the body. So whenever you have a damage of AICA or obstruction of an AICA or PICA, you are going to have a loss of sensation from the opposite side of the body. And this actually brings us to a very interesting topic, which is called the crossed loss of sensation or cross sensory loss. And as I have previously mentioned, that the fifth nerve nuclei, especially the sensory nucleus of the fifth nerve, lies both in the medulla and pons. And they lie, and if you have damage of the pons, lateral pons or lateral medulla, they are going to have a loss of sensation on the same side of the face. But again, they are going to have a loss of sensation from the opposite side of the body. So you see, if you have a loss of sensation of your left side of your face, you are going to have a loss of sensation of your right side of the body. And as you can see, on the opposite sides. So this is called a crossed sensory loss. Very important to remember. So this is the pretty much the most basic idea that I wanted to share with you about the the AICA and PICA syndrome. So this is the basic idea. And we have another syndrome called the medial medullary syndrome. And this actually occurs due to lesion of the anterior spinal artery. Remember the anterior spinal artery, which runs along the in front of the medulla, and also in front and in the mid portion of the medulla. So this image I collected from YouTube. You see a cross section of the medulla and the fourth ventricle behind, and also you have the cerebellar peduncles here, and in the medial portion of the medulla, what you can see that this is the pyramidal tract running in front of the medulla and also in the inferior part of the medulla, and you have the medial lemniscus, and also in the behind you have the 12 cranial nerve nuclei. And that actually makes sense because anterior spinal artery is a lower part. It's in the lower part of your brainstem because it originates from the two vertebral arteries, and 12 cranial nerve nuclei, it's a lower cranial nerve nuclei, right? And that's why that makes sense actually. And then this is the medial lemniscus, and as you can see in the name, you have the medial lemniscus, which is actually a continuation of your dorsal column. And dorsal column actually lies on the medial part of your posterior spinal cord, right? On the two sides, and actually they go up and they decussate and they form the medial lemniscus, and they carry the sensation of proprioception and position, proprioception and vibration. And then the pyramidal tract carry the fibers from your brain to the spinal cord and up to the anterior horn cell to mediate the motor function. So whenever you damage or whenever you block the anterior spinal artery, it's going to deprive of blood to the medial part of the medulla. And if it deprives the medial part of the medulla at the shaded region, you will have a loss of pain and sensation of the contralateral side of the body due to damage of your medial lemniscus, and you're going to have weakness on the contralateral side of the body due to damage of your pyramidal tract. And also again you are going to have damage of your 12 cranial nerve nuclei, which is the hypoglossal nerve nuclei, and you're going to have lesion involving your same side of the tongue, but the tongue will be deviated on the same side, and you will see some fasciculations on the same side of the tongue. So this is the lesion. This is also called the medial medullary syndrome, and this occurs due to lesion or obstruction of the anterior spinal artery. So here this is a angiogram. You can see here those two are your vertebral arteries going up and forming this basilar artery, and those two stems, this stem from one vertebral artery and this stem from another vertebral artery. This actually shows you the anterior spinal artery. And you can see here I have another image. This is a MRI of the brain, and in this MRI you can see this region in a better way. Okay, so yes, so those two are your cerebellum, this is the brainstem, and especially the medulla, and this is the region, the red region is the region which might be involved in a lesion involving the anterior spinal artery. Okay, so this is the medial part of the medulla. And remember the lateral part of the medulla? Yes, the lateral part of the medulla is supplied by the posterior inferior cerebral artery. Lateral part of the pons supplied by the anterior inferior cerebellar artery. So that's the basic idea. So let's get back to the blood supply again, and then let's get an idea of those brainstem syndromes again. Just a review, a fast review of what I have just said. So you have your vertebral arteries running and forming the basilar artery. Those vertebral arteries gives branches like anterior inferior cerebral artery, and this is the basilar artery, gives branches like anterior inferior cerebral artery, which is going to supply the cerebellum but also supplies the lateral part of the pons. And as it supplies the cerebellum, whenever you have a damage of your anterior inferior cerebral artery, you are going to have ataxia and dysmetria. But also it supplies the lateral part of the pons, and that's why you are going to have a damage of cranial nerve nuclei that runs in the pons, or that are in the pons. And one of the most important cranial nerve nuclei in the pons is, as you can already remember, is 7 cranial nerve nuclei. So whenever you have a damage of your posterior inferior cerebral artery, anterior inferior cerebral artery, which I think should be right like that, you are going to damage your 7th cranial nerve nuclei. And whenever you damage your posterior inferior cerebral artery, you are going to damage your 10th cranial nerve nuclei lying on the lateral part. Let me just draw that here. Your 10th cranial nerve nuclei lying on the lateral part of the medulla. And whenever you damage your midbrain, which is sitting, I cannot see it, you cannot see it too. Whenever you damage your midbrain, you are going to have a lesion involving the 3rd cranial nerve. So this is the basic idea about the cranial nerve nuclei. And then in the pons and medulla and also in the midbrain, you have the tracts, spinal tracts running along the lateral and medial parts of the surface areas. So what happens is, whenever you damage the lateral part of the pons or lateral part of the medulla, you will have a lesion involving the spinothalamic tract. Okay, so you will have a lesion involving spinothalamic tract, causing a loss of sensation on the contralateral side of the body. Okay, and so whenever you have a AICA lesion or a PICA lesion, this is going to cause a loss of sensation from the contralateral side of the body. And actually, you have another thing which is also common, another sensory nucleus, which is the 5th cranial nerve nucleus that runs from your pons to the medulla, and you will have a lesion involving the same side of the face. You will have loss of sensation of pain and temperature from the same side of the face. So this will cause a crossed sensory loss from the face on the same side, and sensory loss from the opposite side of the body, especially loss of pain and temperature on the opposite side of the body. This is the basic idea about the lateral syndromes. And on the medial part of, and also another important thing that I forgot to mention is the vestibular nuclei. So the vestibular nuclei also lies along from the pons to the medulla, and you will have damage. If you have a damage of this vestibular nerve nuclei, it's going to cause vomiting, vertigo, and nausea. This is also common for both AICA and PICA syndromes. And for the medial part of the medulla, as you can see, this spinal artery runs along the medial part of the medulla, and right along the borders of the mid portion or medial sulcus of the medulla, you will have the pyramidal tract, as I have already shown on this image right here. And if you damage the anterior spinal artery, you are going to damage the pyramidal tract. So you are going to have a hemiparesis from the opposite on the opposite side of the body. You will damage the medial lemniscus, which lies on the medial medulla. So you are going to have loss of sensation like proprioception and vibration from opposite side of the body. And also you will damage the cranial nerve nuclei 12, because it's the lower nuclei, and actually this part of the medulla is supplied by the anterior spinal artery, and anterior spinal artery damage will cause a lesion of the 12 cranial nerve nuclei, causing ipsilateral deviation of the tongue, and also you'll have some fasciculations. So I think this is the most basic idea. But again, if I want to have one thing, remember, if I want to remember just one thing on your AICA and PICA lesion, you're going to have crossed sensory loss, number one. Number two, on your AICA and PICA lesion, you are going to have damage of your 7th cranial nerve nuclei. On your PICA lesion, you are going to have damage of your 10th cranial nerve nucleus, causing hoarseness and dysphagia. So those are the most basic. And if you damage your midbrain, you are going to have a lesion involving the 3rd cranial nerve nuclei. Okay, that's the pretty much most basic idea that I would remember from all of this discussion. Thanks all for watching my video.